After a long spring spent at home, many Americans are debating whether or not to take that long-awaited summer vacation despite the threat of the ongoing coronavirus pandemic. The CDC warns that travel increases your risk of getting infected or spreading COVID-19. Staying home this summer is the best way to protect yourselves and others from getting sick. Health experts have weighed in on the risk involved with travel to help people make educated decisions this summer. Here's what they are saying. It may be tempting to scoop up that cheap airfare this summer, but air travel poses a high risk because of the highly trafficked touch points where infected respiratory droplets may be spread, like check-in counters, security checkpoints, as well as the close proximity of passengers on the plane and limited airflow in the cabin. Traveling by car is your safest bet, but if you must fly or take a bus or train, experts recommend 2 weeks of self-quarantine before your travel date. Renting a car is considered low risk. Check the rental car company's COVID-19 cleaning policies and bring your own supplies to give an additional wipe down of high-touch surfaces such as the steering wheel and door handles before you get inside. The biggest risk of driving a rental car is who is driving with you, who may unknowingly infect you in the confined space. Doctors warn that since evidence of coronavirus has been found in human waste, the risk of using a public restroom is relatively high. When flushed, stool or urine can escape into the air and spread particles of fecal matter that could be carrying coronavirus. Contamination may also occur on infected door and sink handles. It's best to avoid public restrooms, but if you must use one, avoid ones that are crowded, wait 2 minutes between users, and disinfect your hands thoroughly before and after exiting. If both families have been quarantined and have limited exposure to the outside world prior to the trip, sharing a vacation home with another family is considered low risk. Clean the home upon arrival and limit activities outside of the house to ensure everyone stays healthy while vacationing. If you have to travel this summer for personal or business reasons, staying in a hotel room itself is considered low risk. However, spending time in hotel common areas like gyms, lobbies, and elevators pose a more significant risk. Check with the hotel about their COVID cleaning policies and protocols, disinfect your room's high-touch surfaces like the TV remote, and don't use the hotel bedspread. Experts agree that camping is relatively low risk as long as campsites are not crowded and are spaced properly. Exercise caution when sharing restrooms or communal picnic areas, as these variables increase the risk of contracting or spreading the virus. Before packing up, check for any travel restrictions and health department updates from your planned destination and any stops you may have to make along your way. It's possible that state or local governments may already have or suddenly mandated quarantines or border closures. Remember that travel not only puts you at a greater risk for contracting the COVID-19 virus, but also makes it possible for you to spread the virus to others if you are sick and not showing any symptoms. Whatever your plans include this summer, always put safety first.